everybody, I'm Gillian. I'm the medical esthetician at Dr. Asadi's office. Today I'm going to be doing a dermaplaning procedure on Alyssa. Dermaplaning is a manual exfoliation of the epidermis using a sterile surgical blade. We're going to remove all the dead skin cells on her epidermal layer and her peach fuzz, the vellus hair. Just tilt your head a little this way.
And what did you use to prep the skin?
I cleansed her skin with a sensitive skin cleanser, and then we prep the skin with an acetone solution to degrease it so the blade can slide nicely. You see all that dead skin, those little white flakes are dead skin cells.
How often do you recommend this treatment?
Usually once a month. It's a nice deep exfoliation, but patients love it, you know, for the hair removal benefit as well. So in about 3-4 weeks, that vellus hair will start growing back.
Do you think it grows back thicker the more you dermaplane or no?
No, absolutely not. We're not affecting the follicle. That's an old wives' tale, you know, that'll come back thicker or darker. Vellus hair is vellus hair. It's going to come back that peach fuzzy hair that it always is. And you'd be surprised after you have this removed, your makeup goes on so nice and smooth, your skin just glows. Patients love it for that as well.
Do you recommend it with other treatments or like a standalone?
It can be done, it's wonderful with other treatments. It's great with chemical peels, with the hydrofacial. It's really removing a whole layer that any product or procedure you're doing no longer has to go through to get to where it needs to be to do as much work as possible. So something like, you know, the hydrofacial where you're exfoliating, you're deep cleansing, you're infusing the skin with all different solutions and serums. It's just removing a whole layer. So all those serums and solutions can get into the skin a little deeper. It's great before microneedling, you know, with PRP. It's a whole nother layer that the needles don't have to go through, that the PRP doesn't have to go through. It's a great prep for any treatment.
And there's no downtime, no restrictions after getting dermaplaning?
You want to be a little more careful, you know, in the sun, the way you would with any procedure that's going to exfoliate the skin. You're going to be a little more sensitive, you know, to that, but you should be wearing, you know, sunblock and being mindful of the sun regardless every day, you know. But that's really That's really all I would say. Depending on what you're doing it in conjunction with, if you're, you're doing it as a prep before another procedure, then there'd be different
Instructions, yeah.
Tilt you that way.
Can we check out the peach fuzz we have?
Sure. And we're not done yet.
Now, how's my skin? Do you think it's on the drier side?
You're a little bit dry. So you would definitely benefit from doing something like a hydrofacial after this. Infuse all those good serums, hyaluronic acid.
Thanks for watching.